Hi, regarding bone spurs are these little spurs that come off the vertebrae, and we call those osteophytes. It's all a form of degenerative joint disease. The important thing to understand about bone spurs is that bone spurs can obstruct nerves. They can inflame and impinge nerves. Bone spurs are usually a result of an area that is unstable. Either the weight bearing of that particular joint is imbalanced, causing things to degenerate much rapidly, but generally bone spurs come off the anterior part of the vertebrae as well as the posterior, but more commonly you'll see them in the anterior part of the vertebrae. The reason is because as the curve of the neck straightens out, the weight bearing of the head becomes more anterior. That's why you get more degeneration, predominantly in the mid-cervical spine between C4, C5, C5, C6, C6, C7. And as a result of that, you can then develop osteophytes, which is bone spurs. This is an osteoblastic type of condition, generally as a result of something that's unstable. But again, the important thing I think you should understand about bone spurs is that many times a physician will say you have a lot of spurs, look where your spurs are at, but guess what? Anytime you have bone spurs in the front part of the vertebrae, you will become asymptomatic on the nerve because the nerves come out in the back part of the vertebrae, and that is the most important thing that you should understand about bone spurs, because if you have bone spurs in the front, that's not causing compression on your nerve in the back area. It's generally something else. Make it a great day. I'm Dr. Mandell.